Good evening, and we'll start with the session. I hope that everyone is in your comfortable position. So we'll go ahead with the Nursing Foundation 2. As I mentioned earlier, so Nursing Foundations 1, we have discussed in the last session. And now we will concentrate on Nursing Foundation 2, which will start with the chapters, that is health assessment, nursing process, and nutritional needs, hygiene, elimination needs, diagnostic testing, oxygenation needs, fluid, electrolyte, and acid-base balances, then administration of medications, sensory needs, care of terminally ill, death and dying, then psychosocial needs. Under the psychosocial needs, again, self-concept, sexuality, stress and adaptation. This is introductory concepts about stress and adaptation. Then concepts of cultural diversity and spirituality. And lastly, nursing theories. Before I dive into the actual topic on this nursing foundation, let me introduce myself, that I am Dr. Shanta Kumari, having a experience of 20 years in the field of nursing as a teacher and nursing administrator and so on. Then, with regard to nursing foundations, I mentioned earlier, but still today also I would like to tell that how important the nursing foundations for every beginner in the nursing profession. So whenever you enter into the nursing course, that is after the intermediate, whoever is got admission into the BSc Nursing program, I hope nursing students are watching this one. So for them, like a beginners, whenever you are stepping into the nursing college, you might not have any idea about nursing. But purely, if you look into the history of nursing, it is which is very, very oriented to service and also occasion oriented. It means it's a job oriented course, and it is also a service oriented course. Why? Because nurses are working with the human beings, not with the computers or not with the papers or not with the accounts or anything, but they are working with the human beings who are having feelings, expressions, emotions, and other, like they have their own feelings. And whenever we are dealing with the human beings, when we are providing care, whenever they are coming to us, in that cases, we should provide nursing care in a compassionate way and empathetic way. Sympathy should also be having. It is one of the quality of a nurse. So like that, it is very important to develop an attitude towards the nursing, and this is the primary requirement for the nursing student. So whenever you are, for example, in general, whenever we are entering into a new environment, we feel like very new and we do not know who is around, and new environment, new people, and new things which we will be coming across. So think about the patient. First time they will be coming to the hospital and they are exposing to different diagnostic tests, and then different nursing personnel and healthcare professionals and different types of equipments. So with all these, the patients will be in a state of confusion and they will be very anxious, frustrated. So and the family members, whoever is attending, so they also, they were very anxious about their health condition of their own family member or the patient. So like that, with the different feelings the patient and the patient family members will be coming to the hospital. So in such scenarios, how best as a nursing student, how best we can meet the needs of the individual. Here in the second nursing foundation 2, this is all the units are included in the practicals. Like from each unit, there is a practical module, and most of the questions you will be getting in relation to the practicals. And this part is very important in relation to your practical examinations as well as theory examination also. So I will explain you what are the weightage units and what are the frequently asked questions in each unit, and then how to write or how to answer to a question if they asked for a long essay or short essay or very short answer and multiple choice questions. How to answer or how to organize your answer in the answer script, and if you want to fetch marks, how you should write, the style of writing your answer paper. These things I'll be discussing in this session. And before I could exactly start the session, I would like to introduce our company, that is Prakara, a Prakara Learning Private Limited. It's a digital platform where you are going to have the video assisted lectures, and there will be lecture notes and terminology or glossary, or the key terms will be there, whichever the difficult words are there in that particular video. And soon after finishing your video and the lecture notes, you can assess yourself where you are standing, or you can assess yourself like how much you have got from that, how much knowledge you have gained by watching that particular video lecture. So without further delay, I just wanted to continue with the weightage units. What are the weightage units in relation to Nursing Foundation 2? So it starts with the first unit is health assessment, and the second unit is nursing process. Nursing process is a very important chapter. It is both in clinical and theoretically. It is important. Here you will be learning about the learning about the nursing process and what is the definition of nursing process and the different steps of nursing process. And each step again, there will be an explanation with the examples. And here you will be like most of the questions, essay question is expected from this unit, and the short answer question and MCQ also. Then coming to the hygiene. So hygiene and oxygenation needs, fluids, electrolytes, acid-base balance, this all comes under like a hierarchy of human needs, Maslow's hierarchy of human needs. Or in the previous syllabus, it was, the unit was meeting the human needs of the patient. So under that, the first one is a hygiene. Personal hygiene and environmental hygiene, both are important. Here, from this unit, the important question you are going to get is decubitus ulcers or pressure sources. What are the causes for pressure sources and what are the risk factors? And how do you examine the level of the pressure sources? There are different scales to estimate the pressure ulcers or the decubitus ulcers, and how best you can prevent. First, prevention is better than cure, as you know. So prevention, what are the preventive measures or control measures to prevent the bed sores or decubitus ulcers or pressure sources, or are one at the same? And what is the, if at all, if the patient develops pressure sources, how best you can provide care and see that the healing of the pressure sources would happen. So that you will be looking into that. And then patient unit, this was providing safe environment, that was dealt in Nursing Foundation 1. And coming to the unit 7, that is oxygenation needs, meeting the oxygenation needs of the client. Here the oxygenation needs are very important. If the patient comes with any respiratory difficulty or ineffective airway patency, and then ineffective respiratory pattern. So like there are different nursing diagnoses. Mainly if the patient comes with any respiratory difficulties, problems, then the patient definitely requires oxygenation. So what is oxygenation, and what are the different sources of oxygen, and what is the method of administration, and what is the procedure for meeting the or administration of oxygenation needs. These things you will be knowing in this unit. And here in this, from this unit also, you are going to get one essay question, which is very important. And then moving on to the other unit, that is fluid electrolytes. And from here, the short answer questions are important. Then administration of medications. This is equally important in theory as well as practicals. So there are like what are the various routes of administration of drugs, and then what are the rights of administration of drugs, how you are going to store, like storage and maintenance of the medications. This you will be knowing in this unit. And from this also essay question and the short answer questions are expected. Then coming to the other important thing, that is care of terminally ill, death and dying. Here the important question is what are the steps of dying person, and what is the care you are going to provide for the terminally ill patient, and care of death and dying. Then stress and adaptation. So what is stress, and what are the stressors, different types of stressors, and what are the coping mechanisms? There are different coping mechanisms, how you will be able to relieve the stress and provide coping mechanisms to the, or helping the patient to adapt to the coping mechanisms whenever they are coming across with the stresses. So from all these units, like there are 7 units. So in this, from these 7 units, most of the questions, 90% of the questions will be coming from these units. Then we will see unit wise in detail, starting with the health assessment. So here the health assessment could be done with the help of interview techniques, observation techniques. So interview techniques and observation techniques are important to collect the, or to have the assessment on the patient. What is the purpose of assessment? Why do we do health assessment? So to provide, the first foremost thing is to provide high quality care. That is one thing. And to see that the patient, all the needs and problems will be noted prior to the physician examination. So whenever you are ready with the history collection and physical examination as a part of the health assessment, then the with the help of this information, it will be useful for the physician to go in depth, and again you can plan care as per your health assessment. That is, I mean to say that so nurses are responsible for doing initial health assessment. Again, there are different types of health assessment: initial and ongoing, concurrent assessment, and at the end of the, during the recovery phase also, we will be doing the health assessment, then reassessment before you could change the plan of care. Like that, there are different types of health assessments. And coming to the process of health assessment, here I already mentioned that we will be starting with the health history, then physical examination. Here I would like to put one important point. Usually when we ask the students to write about the health assessment of a client in the clinical area, just they will be writing under the health history, identification data, and few things will be noted, jotted down in the nurse's notes. or nursing care plan. Then they will be writing about the physical examination, head to foot observation. That's all. Everything is normal, normal, normal like that. So there are particular techniques to perform the physical examination. So here are few things mentioned here, that methods. What are the methods we will be using to perform physical examination? Each and every student is responsible to follow these methods like inspection, palpation, percussion, auscultation, and olfaction. Nowadays, we are not going with the percussion, but you should know what is percussion. With the help of inspection, what are the things you are going to observe from head to foot, and then by palpation, there are only certain body parts to be palpated. In case of female, breast examination, and in case of both male and female, we will be palpating the abdomen to find out any abnormalities in the abdominal area or abdominal cavity. And then coming to the auscultation with the help of stethoscope, usually from our side, like as a first year student, you will be concentrating on the vowel sounds and breath sounds and heart sounds. So then preparation for examination, patient and the unit, both the things. We should prepare the patient and as well as the unit where the patient is being examined. And general assessment, that is a general appearance and assessment of each body system, starting with the like respiratory system, cardiovascular system, digestive system. There are specific areas, all these areas, body systems to be examined just to detect the deviations. That's all. And if the patient, for example, if the patient comes with the respiratory problem, we will be assessing the respiratory system in detail, whereas other systems will be examining to find out any deviation or any connection with the respiratory symptoms. That should be noted. Then after assessing, documentation is very important. Remember, students, everywhere, whatever you are doing, documentation plays a very important role. You should document what are the health assessment findings which you have noted while doing health assessment. So here the frequently asked questions from this unit. This is about the health assessment. And what are the frequently asked questions? So usually they'll ask define health. You should write about the definition of health as according to WHO. Then that is a complete state of physical, mental. Everybody knows, I think, definition of health as per the WHO. Then enlist the purposes of health assessment. What are the purposes? And each this is asked for essay question like 12 marks, 13 marks, or 15 marks. So you should mention each like a purpose, providing high quality care and to assist in the examination of the physician. Like that, whatever the purposes you have been mentioned, each purpose should be explained in detail. That is very important. Then what are the methods of physical examination? So I said to you that with the help of interview techniques, observation techniques, again, in the whenever you are doing observation with the help of inspection, palpation, percussion. So these things you should write in detail by taking some examples. Then other question, Mr. Ramuru is admitted with dyspnea. Write the procedure of doing nursing assessment. So the procedure of nursing assessment starts with the health history. Again, in the health history, you will be noting down the identification data and the present history, past history, and again in the past history, medical history, surgical history, and any medication history is there. These things you have to mention. Then you should write about the family history. Any of the family members are suffering with the chronic obstructive pulmonary disease, which is related with the respiration. And here I said about diarrhea. So diarrhea, there will be no much family history. It is like there is no chronic disease which is related with the diarrhea, or you can find out any chronic illnesses or terminal illnesses like diabetes, hypertension, and any cardiac problems, and then any cancer like that. You have to notify, or you have to collect the history about the family. Any of their fathers are suffering with any of the long-term condition, disease condition. Then after that, we will be asking about the socio-economic history, under which social status they fall, that family falls, and what is the annual income. Why we should know the socio-economic history or the annual income and the family number of members in the family. By knowing these things, we can assess what type of diet they are taking and what is the exact cause for their disease condition. In that way, it will be useful to by finding out their history. The history will be useful to find out or correlate with is there any relationship between the disease condition and their information about their family. Then coming to their personal history. So personal history also very important. In the personal history, we will be asking about their rest, sleep, how they are, how many hours they are sleeping, and what are their rest periods, and then what are their, how they are, their bowel habits and bladder habits. Like that, we will be asking in detail about the personal history. And then nutritional history is also being asked, like what is the meal pattern and whether they are vegetarians or non-vegetarians. By knowing detailed history of the patient, we will be able to plan care according to their culture, and we will take some of the ethical considerations by knowing their history. Here, we will be knowing the system examination with regard to the gastrointestinal system, because it is diarrhea. Systematic examination or the body system, in detail body system examination will be done with regard to gastrointestinal system. And for that procedure, again, on inspection, what you are going to see, the shape of the abdominal cavity on inspection. Okay, either it is, usually it is oval in shape, whether it is round or distended. Like that, we have to mention by inspection what are the signs you have noted, and then by palpation, is there anything, or the is it loaded with the fluid. Like that, you have to mention and use the correct terminology whenever you are writing the nursing assessment. So this is how you should write, like what is the definition of the assessment, and you should write about what are the components of the assessment. Then you will be explaining about, in case of diarrhea, what are the what should be concentrated, that is GI system, gastrointestinal system should be examined or assessed in detail. So these things you have to mention, then only you will be going to get the full marks. Then again, enlist the purposes of history taking, then write short notes on the biographic data, psychosocial history, history of present illness, past illness. These are some of the questions. Then for this short answer question, you can mention 5 to 6 points. Then moving on to the second unit. This is very important unit, as I mentioned in the introduction. So critical thinking, competencies and attitudes for critical thinking in nursing. So overview of nursing, here you could see that assessment, nursing, diagnosis and planning, implementation and evaluation. These are the 5 steps: assessment, nursing, diagnosis, planning, implementation and evaluation. So I already mentioned about the assessment. So whatever the assessment you have collected with the help of history taking and physical examination, that to be collected, and it could be like you will be using different types of methods of collection, that is by interview technique or by observation technique. Those are the types to collect the data, and sources from case sheet, from the investigations. So that, or any, if there is a past history, medical history, any, if the patient comes with already some disease condition. So from the case sheet or from the, and from the reports, you will be getting the data. And methods, that is same like interview technique, observation, and you will be giving some questionnaire. So with the help of those things, you will be collecting the data, and whatever you have collected, that data should be organized. Then organized in the pattern of history taking and physical examination, then validating the data, whether is there any correlation between your assessment and the data which you have collected. You should validate, and then it should be documented. Then nursing diagnosis. Here, nursing diagnosis is always different from medical diagnosis. Medical diagnosis will be made by the doctors, and nursing diagnosis will be made by the nurses. And there are standard nursing diagnoses which are given by Nanda. So Nanda approved nursing diagnoses are available. So based on that, you should give the statement, nursing diagnosis. So identification of the client problems, risk and strengths, nursing diagnosis statement. So here nursing diagnosis consists of 3 components, that is the etiology, and then related things, and then you will be having the characteristics. So etiology and the related any disease condition, and then the characteristics. So there are 3 components. With the help of 3 components, you will be stating the problem statement, and then based on the problem statement, you will be planning. There are again different types of planning. You will be knowing in the initial planning, ongoing planning, and discharge planning. So the various types are there. And then whenever you are planning, you should first establish the priorities. So what are the priority needs to be met first? So for example, if the patient comes with admitted with the dyspnea, like breathlessness, first you will be meeting the oxygenation needs, then you will be switching on to the other needs like hygienic needs, and then nutritional needs, like that. So first prioritization of the needs is very important. So you should know what are the actual problems and what are the potential problems. When do you say it is a problem? Whenever the needs are not met by the individual, then it will become a problem. So what are the problems? That problems, actual problems means whenever the patient is admitted, that time what are the problems you have seen, and immediately that actual problems should be met. So then after meeting the actual problems, so say for example, like I mentioned earlier, breathlessness. First, you will be administering the oxygen based upon the doctor's prescription or doctor's order. And then before administering oxygen, you will be placing the patient in a comfortable position, usually semi-Fowler's position or Fowler's position, depending upon the severity of the dyspnea. Then you will be administering the oxygen. First, you will be meeting the needs of the oxygen. Then you will be going to the other needs. So actual need here is oxygenation need. And the potential needs may be the patient, whenever the patient is on like oxygen. So there should be some intermittent pauses should be there if the disease condition is not severe, or that is breathlessness is not severe, and if the patient is able to take orally, if the patient is permitted, then you can meet the nutritional needs. Suppose if the patient is having severe dyspnea and she is unable to, or he is unable to take fluids or diet through orally or mouth, then we should plan for meeting the nutritional needs in a fluids form. So like that, you should have the proper justification for the actual needs and the potential needs. So what immediate needs or comes under the actual needs. So whenever these needs are not met, then it will become a problem. Then based upon the priority of the needs of the client, we have to plan care, whether it is a short-term goals or long-term goals. Short-term goals, again, it will be meeting the immediate problems of the patient, and long-term goals, those are the potential problem. Suppose if the a patient who comes with the unconscious, then the patient will be bedridden. So patient cannot move by himself or herself. In that cases, we have to prevent pressure sources. That is the potential. So for the bedridden patient, potential problem is pressure sources. So you should prioritize the needs of the patient, then you should plan accordingly, whether it is a short-term goal plan or long-term goal plan. When after planning, you will be implementing, exactly executing the nursing care activities. Then once you execute the nursing care activities, then you should carry out the evaluation process. In evaluation process, you will be notifying the outcomes of the patient, whether the whatever you have planned, like establishment of the breathing pattern, that is the normal establishment or effective breathing pattern is the goal. So whether this goal is achieved or not, that you are going to evaluate. Then if the patient attained normal breathing pattern, then that means without assistance of the oxygen administration, then the patient outcome is good. So in that way, when the patient is relieved from that particular problem, then you will be mentioning that patient outcome is good. If suppose if the patient condition is not improving or it is gradually improving, so based on that, again reassessment. So because the needs are not constant, it is dynamic, it will be changing. So you have to monitor the needs and then reassess and then replan. And again, this is a vicious cycle, like assessment, diagnosis, planning, implementation, evaluation, and again reassessment. So you should assess the best possible solution for the identified problem, and then you should execute the respective problem. And here I should mention one thing. Whenever you are planning, like example, the problem statement is ineffective airway breathing pattern. That is a problem statement. So here the goal is attainment or relieving the breathing difficulty or attainment of normal breathing pattern is a goal. So for this, the nursing interventions or nursing interventions or the actions, whatever you are planning is you will be relieving the breathing difficulty or you will be establishing the normal breathing pattern. That is the goal. For that, there will be number of nursing activities. First thing is you will be positioning the patient in semi-Fowler's or Fowler's position and placing the cardiac table to rest over the cardiac table. That is position. Under the position, all the things will be coming. And then after positioning, you will be administering the oxygen, and then you will be writing the other nursing actions like meeting the nutrition needs and then hygienic. Like there will be 3 or 4 nursing actions you have to plan, and then it should be executed. So after execution, you will be evaluating whether it is effective or not. So then after that, you will be documenting the normal breathing pattern is established or the patient is relieved from breathing difficulty. So this is how you should mention. Even when you are answering in the question paper, you should clearly mention with the help of example, and then only you are going to get full marks. Clear? Then moving on to the other like frequently asked questions here, or define nursing process, describe the steps of nursing process, in detail. Whatever I have mentioned, you can write it in an organized way. Then explain the nursing diagnosis statement, parts, types, and with the examples. So here you should write about the nursing diagnosis statement. It consists of three parts, like a problem statement and the etiology of the statement problem and the related characteristics of the problem. Then what are the types of the nursing diagnosis, actual nursing diagnosis and potential nursing diagnosis. These things you have to explain with the help of examples. Based upon the marks, you should take the examples and write it. Then explain the levels of critical thinking in nursing process. It's a direct question. Then when a client comes with dyspnea, how do you prioritize the goals while planning care? This I have already explained to you. Then nutritional needs. This is a very important and easy unit where you can fetch more marks by writing the questions in a simple way without much preparation. Here, factors affecting nutritional needs and assessment of nutritional status of the individual. This is very important. You have to assess by collecting the history which is related with the nutritional history. So here nutritional history plays a very important role. Then based on the assessment of the nutritional status of the individual, you will be planning for a therapeutic diets. So here they have mentioned that when a patient is dysphagia, so difficulty in swallowing, and when the patient comes with the anorexia, loss of appetite, how you are going to meet the needs of these nutritional needs of these clients, nausea, vomiting. In these conditions, how best you are going to meet the nutritional needs of the clients. This you have to mention. Then principles, equipment, procedure. So these are the procedures you will be learning in detail in the nursing practicals, nursing foundation practicals. So here the questions, frequently asked questions are, what are the various ways of providing nutrition to the patient admitted in hospital? So it starts with the oral feeding, the nasogastric feeding, gastrostomy feeding. So like depending upon the patient condition, we will be providing total parenteral nutrition. So there are many ways, there are various ways to provide nutrition to the patient or meeting the nutritional needs of the patient. Then briefly discuss about the parenteral nutrition. So parenteral, this is other than oral. So there is a total parenteral nutrition therapy where the patient is not taking because of the health condition. So how it should be and how much we have to give. So the regular things you have to mention here, and the specific to the particular parenteral nutrition. If they asked you for here, you have to write what are the different parenteral nutrition and explain each in a short way. Okay, 3 or 4 lines you can explain every which comes under the parenteral nutrition. Then short notes, nasogastric feeding, gastric analysis and nutrition assessment. Here you should write what is the nasogastric tube feeding or Ryle's tube feeding. So what are the indications for Ryle's tube feeding, and what is the procedure, what are the articles required, and then after the care of the patient and the documentation, everything you have to mention here. Then gastric analysis, how it will be performed, when it will be performed, what are the precautions, what is the patient education, this you should mention. And nutritional assessment, here it will be starting with the anthropometric measurements, nutrition history, anthropometric measurements, clinical examination, and with all this we are going to assess the nutritional status of the patient. So these things you have to mention in short because it is asked under the short essay. Then moving on to the other unit, that is factors influencing hygienic practice. This I have already mentioned to you. We'll see the questions like define pressure ulcers or pressure sores or decubitus ulcers, one are the same. Then explain about the causes, stages of the pressure sources or pressure ulcers and what are the manifestations, that is clinical manifestations or signs and symptoms. Then discuss nursing management. What are the nursing activities or the nursing actions you are going to implement, and what are the preventive measures you are going to take as a nurse. Then assessment of pressure ulcers using Braden scale and Norton scale. These are important scales to know the degree of pressure ulcers or decubitus ulcers, and indications and purposes, effects of neglected care. So when you are going to provide bed bath, so these indications you have to mention here. Then moving on to the other unit, that is eliminational needs. Here urinary elimination and bowel elimination, both are important. We'll see what are the frequently asked questions here. Bowel elimination and bladder elimination or urinary elimination. Define elimination. Here you should write both bladder elimination and bowel elimination. Why it is important from nurse point of view. Why we should meet the eliminational needs of the individual. This is very as important as that of the nutritional intake or nutritional needs. How important the nutritional needs are, equally the eliminational needs are important. So from the nursing perspective, you have to mention in detail. Okay, then explain the factors affecting urinary elimination. Then short answers, what do you mean by urinary retention or urine retention? What are the special considerations for collecting stool specimen? Then enema. So whenever it is asked in the short notes, you can write the specific things which are important to get marks. So here in the urinary retention, you will be writing about the what is urinary retention and what are the causes. Then what are the simple measures to relieve urinary retention. Then as a nursing measures, we have to promote the urinary elimination by different activities like encouraging the patient to take sufficient water intake, and then every 2 hour second hourly we will be asking the patient to go to toilet if he is or she is able to go to toilet or the restroom. Then like that we are having some promotional activities to prevent or to relieve the urinary retention. First, we should take nursing measures. If it is not attained, then we will be going with the medical measures like catheterization. So you can mention what is the treatment for that, but nursing measures in detail you can, or specifically you should mention here. And special considerations, stool specimen, how you are, what are the instructions you are going to give to the patient, when it should be collected and how it should be collected, and what are the precautions they have to follow when they are collecting the specimen. So these things, and from the nursing point, how to label that specimen container and what to requisition form, all the things should be written here. Special consideration for collecting the stool specimen and preparing for sending it to the laboratory. Then enema, here you can mention what is enema and what are the types and what are the precautions to be taken while administering enema. Then diagnostic testing, this is the important unit where newly it is included here. So in this you will be noting the routine blood investigations here. In the syllabus, the routine blood investigations and routine stool examinations and sputum culture, routine urine examination, all the routine tests. And in addition to that, overview of the radiological and endoscopic procedures. What are the different diagnostic procedures and pre-test, intra-test and post-test responsibilities of the nurse. That should be known for all the procedures. Here the expected questions are: list routine blood investigations, describe the role of nurse during the pre-test, intra-test and post-test of CBP, complete blood picture. Then short essay, stool examination, and then write about urinary urine analysis. Then oxygenation needs, this I have mentioned. Here you will be knowing about you might have known about the theory. Then we'll see what are the frequently asked questions here. So long essay, define oxygenation. What are the various factors that affect oxygenation? Then briefly discuss nursing responsibilities for oxygen administration and write short notes on pulse oximetry, inhalation, postural drainage. So you have to mention here the oxygenation definition, first question. Then what are the various factors which affect the oxygenation? So there are factors which will affect with the disease conditions that you should mention, and in the various disease conditions how it is influencing like the health of the patient, and what for the patient should meet oxygenation needs, like oxygen administration, in which factors like there are factors like if the patient is suffering with the respiratory problems, then the oxygenation needs are different, and if the patient is going to the higher altitudes, their respiratory needs are different. Like that, if the patient is suffering with any cardiac diseases, their oxygenation needs are different. Like that, there are various factors. You should list out the factors or the indications for oxygenation needs. Then you should explain about each factor briefly. Then you will be getting the full marks. Here, nursing responsibilities for administration, starting with the administration like oxygenation, definition of the oxygen administration, and what are the purposes, and then what is the equipment you are using, and the steps of the procedures. While planning this, what are the nurses' responsibilities that you have to mention. Then pulse oximetry, direct question, and inhalations. Then these are the direct questions you could write. Then what are the purposes for suctioning? Here, what is suctioning and what are the indications and what are the purposes you have to mention. Then what are the various methods of oxygen administration? Here you should start with the nasal prongs, and then mask, face mask, and then venturi, oxygen hood, oxygen tent. Like there are different methods. All the methods you should mention and explain in brief. Then fluid and electrolyte balance. Here I mentioned already what are the things will be there in this unit, and we'll see the frequently asked questions. Discuss the factors affecting fluid and electrolyte balance. So, or when we will achieve fluid and electrolyte balance. These factors you have to mention and explain about the each factor. And what are the nurse's responsibilities towards intravenous drug administration? First, you should write what is intravenous drug administration and what are the different intravenous fluids. Then you should write about the nurse's responsibilities. Then discuss the principles you will follow while administering the IV fluids, IV solutions that you should mention directly. Then what is the nurse's role in blood transfusion? Should mention about the blood transfusion indications and what are the nurse's responsibilities or what is the role of nurse. Then you will get full marks. Enlist the problems associated with the acid-base alterations. You can write like what is the, suppose if the sodium is less, hyponatremia. So what are the problems which are related with the acid-base balance? There is metabolic acidosis, metabolic alkalosis, like depending upon the which acid is imbalance or alteration, which base is altered. So depending upon hydrogen ions deficiency and bicarbonate deficiency, these alterations you have to list out and explain about each thing in brief. Then describe the blood transfusion, that is the procedure you should write. Then administration of medication. So starting with the medications, purposes, and then the factors influencing medication action, then medication orders, prescriptions, and the systems of measurements. All this you will be learning here in this unit. Then storage and maintenance of drugs and the nurse's responsibility. This is the important question you are going to get from this unit. We'll see what are the questions you are going to get. So what is medicine? You should write the definition, then explain various routes of administering medication, starting with the oral administration and parenteral administration. Again, in the parenteral, what are the different intramuscular, intravenous, intraosseous, intracardiac, intrathecal. So all the routes you have to mention, and each route you should write 1 or 2 lines with the examples. Then you will get full marks. Then write nursing responsibilities in any 3 of the following. That is storage and maintenance of medications. There are different for the narcotic drugs storage is different, and the regular drugs storage is different, and maintenance of the medications, then inventory, indent, everything comes under this storage and maintenance. Then nasal instillation. Here you should write the procedure. Oral medication also related with the procedure, and intradermal related with the procedure. You should write what is nasal instillation, what are the purposes, and what is the equipment, and what is the procedure. For all the questions, under these headings, you have to write the answer. Then short answers, enlist the sites of injecting medication in body cavity. So it depends upon the, if you are, depending upon the parenteral route of administration, here it comes like a body cavity means, don't get confused. Then enlist the muscles used for giving intramuscular injections. What are the different sites for giving, or the muscles, deltoid muscle, gluteal muscle. So with the help of diagram, you can explain where does the muscles are and what is the name of that. Then sensory needs. We'll see what are the expected questions. List the causes and risk factors of unconsciousness. Describe the nursing management of unconscious patient. So here you have to mention about the causes and risk factors for unconsciousness. And there is a lot of things to be written here. Like nursing management starts with the care of eyes. Total body care should be taken, and prevention of pressure ulcers also one of the point. So from the top to bottom, whatever the nursing care, procedures are there. Care of, you can mention the bed bath procedure also here. Then care all the needs of the patient, starting from the hygienic needs, nutritional needs, eliminational needs, and the prevention and preventive measures, that is decubitus ulcer. All the needs you should mention for this unconscious care. Okay, then factors affecting sensory function. This direct question, arousal mechanism, which is there in the sensory needs. Okay, then so there is a time out, so I'm going fast. This here, from this unit you will be getting explain in detail the care of dead patient and enumerate the phases of grieving process. So here you should write the care of dead patient. So what the procedure, how you are going to prepare the patient to prepare the dead body to the family members. That whole procedure you have to write. Then enumerate the phases of grieving process, their denial, bargaining, anger. These process you have to mention here. Then write the medical legal issues related to death and dying. Then stages of grief. Here you should write this denial and in short. Here you can explain in essay, long essay you can explain in detail, and short essay you can mention the steps and write in one sentence. Then write the signs of clinical death. So these are all the direct questions you can write in an organized way. Then self-concept. Here you will be getting the questions. Write the factors affecting self-concept and discuss the components of self-concept. We quickly see the sexuality is another a question. You are going to get factors affecting sexuality and discuss sexual development throughout the life. Then stress and adaptation. Here the important questions are define stress, discuss the general adaptation syndrome in detail, then list the coping mechanisms, explain any 5 of them with examples. Then short answers, discuss briefly about diversional and recreational therapies, write about the types of stressors. These are the direct questions. Then here transcultural nursing is important and factors affecting spirituality. The nursing theories again, you'll be the expected question from this unit is define nursing theory, purposes of nursing theories, explain in detail about Roy's adaptation theory in nursing practice. So the Roy's adaptation theory, you can mention like by with the diagrammatic representation, then you will get good marks or full marks. Use of theories in nursing practice, why it is important, what is the use, then write the purposes of theories. These are the direct questions you can learn and answer. Now we'll see. So in the last session, I said that we will show you the pattern of question paper. This is the new pattern, the semester 2 nursing foundation 1 and 2. Maximum marks are 75 and the total hours are 3 hours. So first question, answer the following questions, write an essay on any 2 of the following. Here you got the define physical examination, list out the purposes of physical examination, describe the techniques, methods of examination. So under the separate headings, like under 1, you will be writing A. In A, small 1, Roman letter 1, you will be writing the definition of physical examination, and 2, you will be mentioning the purposes 1, 2, 3, 4, 5, like that. Then describe the techniques. You will be starting with the techniques, interview technique, observation technique, and then methods again, inspection, palpation, percussion, like that. Everything you should write step by step and you should give examples. Then you will get 15 marks. Then another question, define oxygenation administration. Then list out the principles of oxygen administration. Explain the methods and complications of oxygen administration. So separately you have to write the B, then under B, Roman letter number 1, you will be writing the definition of oxygenation. Then list out the principles one by one you are writing. And third, you will be explaining about the methods and complications. First, you should write the methods, and each method you should mention briefly, like nasal prawns, how many liters of oxygen, maximum how many liters of oxygen, only 2 liters of oxygen will be given. Like with every method, nasal prawns, mask and venturi mask, like different methods are there. Then what are the complications you should write? One of the complication is like it will be causing the retinal detachment if it is given excessively. Like that, you have to mention the complications and then write one word, the meaning of that one. Then another question, define nursing theories. What is the theory? So definition of the theory you should write, and then nursing, then correlate with the nursing theory. Then what are the purposes of nursing theory? Why theories are introduced, and what is, by following theories, what are the purposes, what are the benefits you are going to get. Then explain in detail about Roy's adaptation theory. So Roy's, that is stress adaptation. During the stress times, how do we adapt different methods, how best we can provide care by implementing the conceptual framework of the Roy's adaptation theory. You should draw and then explain by taking one example in the nursing practice or clinical area. You can select one example and apply the conceptual framework of the Roy's adaptation theory. Then Write short notes on any 5 of the following. Each one carries 5 marks, 25 marks. So purposes of health assessment, direct question. Explain the levels of critical thinking in nursing process. This is also direct question. Then total parenteral nutrition. You should write indications and the procedure in brief, then grief and bereavement. These are the definitions you should write and the process of grieving. Then nosocomial infections definition and what are the various nosocomial infections which you will see oftenly. Then decubitus ulcer definition and the causes. Then you can write the nursing care. Transcultural nursing definition you should mention and how important it is to provide competent care by looking into the culture and then the ethics of the particular patient and how you are filling the gaps in building up the therapeutic relationship with the help of communication. So transculture is very important to consider the culture of the individual, traditions of the individual, that is the patient, whoever admitted in the hospital. So that short answer you can, if you write those things, you will be getting the good marks. Then write short notes on any 4 of the following. Preventive measures of STD, that is sexually transmitted diseases, and factors affecting self-concept, autopsy definition, then define nursing process. Here 2 marks, so just mention what exactly it is. 2 points is enough here. So 2 preventive measures and 2 factors, a definition of autopsy and definition of nursing process. Then there are multiple choice questions. 7 choose correct answer of the following multiple choice questions which are apparent only to the client concerned. Subjective data or objective or soap or soapier. So you should think and then answer. Eye examination is done in a which position? So you should be thorough with all the units. So here are some of the MCQs you can go through. Then intradermal injection is given into which part? Like this is an easy question. Then forensic autopsy is done if the death occurred is due to. Fill up the blanks also, may be expected and natural, suicide, accident, all of the above. Then bad breath is also called gingivitis, halitosis, both 1 and 2 or none of the above. Chelosis can occur due to deficiency of B, C or D or E. Then vitamin D helps in normal growth of hair, muscle, bones, nails. The enema is used to make diagnosis is barium enema or emollient or anesthetic or cold. Accumulation of air in the lungs is called the discoloration of the body after death. So like this, you will be getting the multiple choice questions in this semester-wise examination. So you should thorough with all the units. So before I close this session, I would like to look into this. This is the MLP mini learning program we have introduced. You will be getting the video lectures and then student notes, key terms, self-assessment tools are available for the first year, that is SEM 1 and SEM 2. Please do subscribe for this MLP. I hope that this webinar is useful, and because of the time constraint, I went on very fastly. So if you have any doubts, you can post and we are here to help you in answering your questions. Thank you.